EGM Network.
Treasure Coast Connector. Connecting residents and businesses of the Treasure Coast. And here's your host, Ellen Contreras.
Welcome to Treasure Coast Connector. I'm your host, Ellen Contreras. This show is partially sponsored by Libby Weissman and her team at Senior Transition Navigator and Luxury Homes of the Treasure Coast. Libby works with seniors and their families, helping them with transition into senior life, offering services like downsizing, decluttering, packing, moving, relocation, and a lot more. For a free consultation, give Libby a call at 772-783-2800 or visit seniortransitionnavigator.com and luxuryhomesofthetreasurecoast.com. Now, most of us have heard of the VNA, the Visiting Nurse Association of the Treasure Coast. Some of us know them for their amazing hospice care. Others know about skilled nursing at home, and some have visited the mobile health clinic. Well, they are celebrating 50 years, and today we're going to learn all about the fantastic services. Joining me in the studio today is Lundy Fields, the CEO, and there are so many updates that he has to share. So welcome to the show.
Thank you, Ellen.
I'm very glad to have you here. I am one of the many adult children that, when my mom was here, needed help. And she was actually on the border of Vero and St. Lucie County. So we know hospice through the Treasure Coast, but I know so many people that have worked with your team of angels. I'm just going to call them that.
Right.
Before we get started, though, I would love for you to share a little bit about your background and what made you want to be the CEO of the VNA of the Treasure Coast.
Okay. Well, you asked for it.
Yeah.
Yeah. Well, I had a global career in healthcare, and I actually retired in 2012. And during that period of time, I worked on a few different projects. And but it was in 2017 that my daughter offered me to go with her on a mission trip, a medical mission trip to Haiti.
Oh, wow.
And
yeah.
at the time, I was kind of like looking around for what I could be doing in Vero Beach. And then she asked me to go on this trip. So we go on this medical missions trip to Haiti. So I go with Haiti with my daughter, Katie. Okay?
Oh, cute. Very cute.
So we go on this medical mission trip. We set up mobile clinics every day for a week in the bush of Haiti, like way into the mountains.
Yeah.
And it was just an amazing trip, just serving the people there. And the mission organization had a unique way of offering their services in the country. They were all offered through a champion in the village. So there'd be a village champion who would organize all of the services for that particular village, whether it's education, whether it would be health services, whether it be food, water, so that that person was really the person that organized all. So at the end of this trip, at the end of this week, Katie and I are sitting up on the rooftop of this mission organization, kind of like a dormitory. And we're looking out over the water, and it's a beautiful night, and I'm connecting with my daughter in ways that's just so cool to be with her. She was a nurse, and she was providing nursing services. And she looked at me and said, "Dad, I think you need to go back to Vero Beach and be a champion for the vulnerable people in your village." And it really just hit me. So as soon as I came back from that trip from Haiti, I started looking around to see how I could be involved in providing access to health care in River County. And I came across the VNA, and someone said, "You got to talk to Anne-Marie McChrystal." So I did. I talked to Anne-Marie, and she said, "Lundy, you got to join our board." So I did. I joined the board in the summer of July of 2017. And then what happened was that the CEO that was there left in January of 2018. They did a CEO search, and I put my name in the hat, and the rest is history.
Well, that is wonderful.
Yeah.
You are one of many people that have been taken out of retirement. And so, and I think that that's a good thing because the VNA has thrived under your leadership. And we're going to talk
Oh,
about
thank you for that.
leadership in the second half.
Yeah.
So I mentioned in the intro that while many people have heard of the VNA, we know maybe one or two services. Could you just give us an overview of what's offered at the VNA?
Yeah, absolutely. So it's a pretty complex organization. We offer a variety of healthcare services. So a lot of people know, like you said earlier, about hospice. People know DNA for hospice, and primarily because of the hospice house. It's such a visible facility in River County. And it's such a huge gift also to this area. And so there's the hospice house, which a lot of people knows about. But most of our hospice patients are actually at home. So we have probably around 220 patients on hospice right now in Indian River County. I would say 210 or 12 of those are in the home.
Oh.
And then we'll have 10 or 12 at the hospice house. So that's the hospice side. Then there's home health. And so in the home health side, typically it's people who are in the hospital and they're going to be discharged and they need help skilled nursing help at home.
Okay.
And so we will send in a nurse or a therapist into that person's home. Usually that service would last about 30 to 60 days. And a nurse or therapist will come once, twice, or 3 times a week during that period of time. So that's hospice, home health, and then we have private care. So this is a service where people actually pay to have people come and stay in their home with them for a period of time.
Oh, okay.
So between 8 and 12 hours a day. And some people go up as many as 24 hours a day. They need round-the-clock service. So that's our private care service. And then on top of that, you mentioned the mobile clinic.
Yeah.
So I love calling it our motorhome of health.
Okay, that's a great way to put it.
So our motorhome of health is out in the vulnerable villages of Indian River County every day of the week. They're out there. You can go on our website, vnatc.com, to check and see where that mobile clinic will be for that particular day. And it is staffed by a nurse practitioner and a medical assistant / driver. And it's basically like an urgent care on wheels.
Wow.
For the most part.
Okay.
Yeah. I mean, I've been on the bus before, and a mom brought her 2-year-old daughter, and our nurse practitioner diagnosed her with strep throat.
Oh,
and this is a mom that may not felt like she didn't really have access to health care. So I always think about that story. What would have happened if the VNA was not there for that mom and that child on that particular day? So we provide a lot of good for our mobile health clinic.
Yeah, and that's great because especially if somebody doesn't have a car,
Correct. Yes.
or they're not really quite sure what to do. Maybe they're underinsured, they're a little nervous. So that is a really wonderful benefit. I love that very much. So before we take our commercial break, we have a few minutes. So I mentioned that hospice, my mom was in hospice, as I mentioned, and your team of people, doctors, nurses, all the medical staff are living angels. So, because that is a very difficult situation to be in for not only the person going through it and the family members, but for the medical professionals. I think it takes a certain type of person. So what would you like to mention about a little bit more about the hospice side?
Yeah. So first of all, people involved in the hospice business or the hospice service have what we call the hospice heart. They are these people with this compassion that really is a deep level of compassion for the patient, for the family, because everybody's going through this for the first time. And the recognition that mom or dad or a loved one is going to be passing is really hard for people to grasp. And so our hospice team really has that level of empathy that they bring into every care setting with the hospice patient and their family.
Yeah.
And Dr. Venazio, super compassionate guy, he's a hospice doctor because of the poor hospice service his grandfather received. And that's really what drove him to be a hospice physician. I love it from the top. We got Dr. Venazio with the hospice heart, all of our nurse practitioners who are out there who do great work as well, and all the nurses and all the aides. Now, the people who spend the most time with these patients are the aides.
Yeah.
So they're the ones that are providing the most personal, intimate care and spend the most time with our patients. And they are wonderful people.
Yeah. And that's why I wanted you to go a little bit deeper. You know, it's nice that you explained how many people are in the system right now, but just to go a little bit deeper, because there are people that really don't understand what hospice is really like, and they think of just the patient, but it's more than that. It's the family members as well. I felt very supported even after my mom passed. They checked in with me.
Yes.
Did I need to speak with anybody? What did I need? You know? So I thought that was really pretty cool.
Yep.
And 50 years. So you have not been here for the start, but what would you like to say about, I know you had some celebrations. What else would you like to say about what's taking place?
Yeah. So we started in 1975 as a home health agency. So here we are in 2025, it's been 50 years. And so it's been great. We've been celebrating now for several months. We had a picnic at our office building. We had a donor event at Quail Valley at the River Club there, which was fantastic. Our golfathon, we kind of celebrated at golfathon, even though it's 35 years for our golfathon this year. We raised almost $500,000 there. So thank you to all the golf pros in this community that support us. And I would say, like, watch this space. We're going to have another sort of blowout party at the end of the 50th year. And so just watch our website. We got a great calendar of events on there. People can check that out there.
That's wonderful. Before we do the break, because Cindy's going to make us do one. Okay. She doesn't take no for an answer. So how do people connect? What is the phone number? And again, the website, please.
Yeah. So the website is vnatc.com. It's really like the best place to connect with the VNA. The phone number is 772-231-5665.
And then on your website, I pulled it off of the website.
Oh my gosh.
Yeah,
okay, yeah.
772-494-6161 on your website.
Oh, that's okay, right.
Yeah,
okay,
but two numbers are better than one.
Yes.
And with that, we have to take a break. We will be right back. Lundy Fields and I have so much more to discuss. Stay tuned.
Hey, you! Host your very own show every week at Evergreen Media Network in Vero Beach. Go live to YouTube and Facebook with up to 4 people and your very own producer. Be heard on more than 15 podcast platforms and local radio. All you have to do is show up and talk. Your guests can join from anywhere in the world. It's easy to get started with the largest podcast studio on the Treasure Coast. Contact Evergreen Media to tour the studio.
At Sunshine Furniture, our 35,000 square foot showroom is filled with the largest selection of coastal furniture on the Treasure Coast. Sofas, love seats, dining sets, and bedroom groups in the latest styles and colors from Four Seasons, Braxton Color, Riverside, Universal Coastal Living, Hooker, Capri, Tommy Bahama, and lots more. We're the outdoor furniture experts and have anything you need for your outdoor living from Lloyd Flanders, Kingsley Bate, Brown Jordan, and Woodard, including a gallery of maintenance-free furniture from Berlin Gardens and Pollywood. Right now, during our Memorial Savings event, we have lots of great half-price specials, including another 10% off on all Tommy Bahama and Lexington furniture in stock or special orders. And all pictures, lamps, and accessories are half price. Sunshine Furniture, $12.95 US 1 in the Publix Plaza, Vero Beach. Don't forget to visit our outlet and sales store directly across the street that is filled with name brand closeouts, and visit our website at sunshinefurniturecasual.com.
Party on, America! It's the Main Street Downtown Patriotic Party, presented by GHO Homes. Pop on over to downtown Vero Beach for a free street party with live music by Reckless Shots, plus kids games, beer, food trucks, and prizes. Be ready to dance from 6 to 9. Admissions as free as America. Sponsored by GHO Homes, Mangrove Sands Golf Club and Restaurant, and Formula One of Vero Beach. The Downtown Patriotic Party, a Main Street Vero Beach event, Friday, May 30th at 6 p.m. in downtown Vero Beach.
Welcome back to Treasure Coast Connector. I'm your host, Ellen Contreras, and I've been chatting with Lundy Fields, the CEO of VNA of the Treasure Coast, and we're diving back into this conversation, and we learned all about the services, okay? And we talked a little bit about your team of angels, in hospice. I'm looking over at Amy sitting here in the studio audience of one. Hi, Amy. I'm sorry. I just got to say hi to Amy. And she's also one of your angels, that provides, nursing care, sometimes to scared and nervous people, right?
Mm-hmm.
Now, there's leadership. We spoke about that a little bit in the first half. And sometimes when people hear CEO and they see an interview, they don't realize how active you are with your team. And so sometimes they say, oh, they're in the ivory tower. And that's not your style at all, based especially on how you came from doing the mission work in Haiti. You like to be boots on the ground. So talk about how you interact with the people in the field at the VNA.
Yeah. Well, we've blown up the ivory tower, so it's not there anymore. And so one of the things that I did to really connect with our team and also with our aides, like I said, they spend the most time with our patients and provide the most personal, intimate care. And they really don't have a lobbying body that helps them. Like nurses all have Nurses Week, therapists have Therapy Month, but the aides are really kind of the unsung heroes in healthcare. So in 2019, I went back to school at IRSC. So as a CEO, I went back to become a CNA. So I went to night school at IRSC for 4 months to become a nursing assistant. And so I've been working in the hospice house once a month since 2019. And one of my first shifts in the hospice house, the hospice house is East Wing, West Wing kind of set up. I'm walking down the West Wing and a woman's coming towards me. And she has a very concerned look on her face. Now, the backstory is her husband, Ron, was in room 11 and had been in the Cleveland Clinic ICU for about 5 days. And Ron was of the generation where he got up and shaved every morning. Even though he'd been retired for 20 years, he'd been shaving every day. And his 3 children and his wife know him as a clean-shaven man. And now Dr. Panazzi has just delivered some news to her saying it's time to have the children come down from New Jersey. And so they were flying in, and she's coming to me, and she says, "Will you please shave my husband?" And I said, "Sure." Now, I'd never shaved anyone but myself, but I grabbed the supplies that I needed. I walked in that room and shaved him, and she was so appreciative. And the kids did come down that day. They said goodbye to Dad, and the next morning he actually went down. And so, the reason I tell that story is I want to encourage all of our caregivers to be looking for how they can provide optimal quality of life for their patients. That's our why statement, right? Optimal quality of life for our patients at all times. And so being there actually in the trenches with our caregivers, really, I think they enjoy having me there because I need to be trained. And just working alongside our nurses and our aides has been just fantastic.
Yeah, and they know that you're not there to watch over them. You went to school, so you are a CNA. So you're there to actually do a job.
Absolutely.
And they love that because now they know that when they have to have meetings to talk about things that are needed, improvements or whatever, you know what's happening on the front line, so to speak.
Exactly.
So that is brilliant. And another thing that I liked when you visit the website, vnatc.com,
Mhm.
is a lot of websites have the team listed and the board, and that's great. But where it says team, it actually says servant leadership. So if you
Correct.
could talk a little bit about that, please.
Yeah, so we follow a model called servant leadership. And basically, we've taken the traditional organization and we flipped it on its head. So at the top of our organization, everybody reports to the patients and the family. Like, 'cause that's who we are there to serve. Internally, our caregivers are at the top of our organization. So all of the support functions, myself included, when I'm a CEO, when I'm a CNA, I'm at the top, but when I'm a CEO, I'm at the bottom.
Bottom. Okay.
But in the servant leadership model, we're there to serve those direct caregivers. People are out in the field providing that direct care. And so everyone at the VNA is there to make sure that our caregivers are equipped to absolutely provide the highest quality of patient care. That's what the servant leadership model is all about. Our energy and our focus is up towards our patients, and internally, our energy and our focus is up towards making sure our caregivers have everything that they need.
No, I love that. I love that so much. And you do a lot for the community, and there's partnerships that you have formed in the community. So do you want to talk about some of that, the different organizations and people that you work with?
Correct, yeah. So I'll just give you an example of how we collaborate with other organizations. So a couple months ago, I was out with one of our start of care nurses, a home health nurse. We went to a patient's home, and this patient had been discharged from the Cleveland Clinic. Then it's about a day or so after they'd been discharged, and the patient had not eaten because they had no food in the refrigerator. And so obviously, you're not going to get better if you're not eating. So what we did is that we immediately called Senior Resource Association and had an emergency hot meal delivered to that patient that day. And then we signed her up for the emergency meals program, which lasts 2 weeks, and then she can get on to the regular Meals on Wheels program.
Mm-hmm.
So we collaborate with Senior Resource Association. We collaborate with all of the nonprofits in Indian River County that provide services that the VNA does not provide. So the McCabe Center, for example, we will
Sure.
recommend people go over there. I was just out actually in a patient's home last Thursday, who the McCabe Center helped him get on the SNAP program. That's about food stamps.
Mm-hmm. Okay.
So he was so appreciative that our social worker connected him with the McCabe Center so they could help him with his food.
I love that. So Wes Salmons was here on this show recently. Cindy is telling us we only have a couple of minutes left. So before we get ready to sign off for the second half, people can watch this as you know, but it's also on iHeartRadio and all the podcasts. So for those that are listening, the phone number and the website. And there's more than one, but we'll give the one that's on the website itself. I'll read it off
You
if that's
read it
okay.
off for us, yes.
772-494-6161 and the website.
It's vnatc.com.
Okay, very good. And is there anything with 30 seconds that you would like to leave people with about the VNA?
Well, if you would like to support the VNA, we always are
Yes.
welcome to that because we do provide services that no one else does. So go to vnatc.com and you'll see the little donate button. So just click that button, and there are 11 ways to give on our website.
That's wonderful. Volunteers and money, and then you have the thrift store. Cindy's going to make me stop talking now. Your thrift store is amazing, and it's in the Miracle Mile Plaza.
Yes,
right?
it is awesome.
Okay, very good. So I wholeheartedly suggest that you go onto their website to see how you can volunteer or make a donation, visit the thrift store. And with that, I want to say thank you so very much for being on the show. I really appreciate it. The support that you give. I'll just say it's almost legendary in the community. That's how I feel about you guys. When I hear people talk about you, it is always in a glowing way.
Oh,
Always
thank you, Ellen.
a glowing way, truly.
Yeah,
And what I want to say also is thank you to Libby Weissman for partially sponsoring this. You can visit her at seniortransitionnavigator.com, luxuryhomesofthetreasurecoast.com. You can call her to learn about living a vibrant senior life at 772-783-2800 and all of the services she provides. My name is Ellen Contreras, host of Treasure Coast Connector. I hope everyone has a wonderful week. And until next week, I miss you already.